So,
And well,
let me call the next speaker, Preet Kaur Gill.
Thank you. It's a pleasure to serve under your chairship, Sir John. Let me start by paying thanks to my friend, the Honourable Member for West Bromwich, for securing this timely and important debate, highlighting the real-life impacts of knife crime in her constituency. Knife crime is a public health crisis. And as an ex-Cabinet Member for Public Health and ex-Children's Services Manager, it is essential that we tackle both the causes and effects of knife crime. In July, the ONS found knife crime in England and Wales had risen by 78% over the past 10 years. And this is a staggering increase and sets out the scale of the challenge facing the new government to reverse that terrifying trend within a decade. The West Midlands Police Force area, I am sad to say, is responsible for 10% of knife-enabled crime in the whole of England and Wales, and only the Met Police have more cases. The statistics never alone tell the real story. And in recent years, I have been witness to some horrific cases as the MP for Birmingham Edgbaston. Jordan Moazami was 18 years old and described as a role model by his peers, who was stabbed and killed on Tennell Road in my constituency in 2019. Mohammed Hassam Ali, 17 years old, who was followed and killed by a 15-year-old after a 4-minute conversation in Birmingham city centre. And D. John Reed, my constituent, 14 years old, who was hounded by a gang of 5 boys and grown men before being stabbed in the chest in 2021 and died. I can't do justice in words to the horror of these cases, and in every one what strikes you immediately is the senselessness of it. And in many ways, I think that is where we need to start, when we think about how to find meaningful solutions to the epidemic of young boys taking each other's lives. Prevention has to be our watchword here. And the root causes to understanding knife crime is complicated. It's often a picture of poverty, of drugs, gangs, exploitation, school exclusion, domestic violence, adverse childhood experiences, and being in care. One of the 2 boys, aged 12 years old, who killed Sean Sisahai in Wolverhampton in 2023, had experienced significant trauma in their life and been at risk of child criminal exploitation. And according to the defence, he had been groomed, exploited and trafficked by men in the community. So that there is a complicated story to tell there. And one of the questions you ask yourself is, who is looking out for these boys? I think child criminal exploitation is often misunderstood by professionals, which prevents the early identification of child victims. Too often, child victims of exploitation are criminalised rather than safeguarded, something which exploiters and organised criminal gangs anticipate and utilise to their advantage. The services that might identify them as at risk, schools, youth services, mental health services, are all under strain. Youth mental health services are in crisis, school exclusions have been at record level high, and youth services have been cut to the bone. And the tragedy is that sometimes it is that absence of a safe space that is putting children at risk. And some of the stories you hear are absolutely bleak. A Barnardo's practitioner at a child exploitation service shared evidence that during winter, groups of children often gathered outside a leisure centre, sat by the air vents, as that was the only place that they could feel warm and safe. And it became a spot for exploitation and described as a hot spot for adults or older teens, with cars driving by and offering lifts and McDonald's. And of course, that is how the dynamics of exploitation start. The favours, the debts, the escalating patterns of criminality. I was struck recently by a comment by Martin Griffiths, a consultant trauma surgeon in London and the National Clinical Director for Violence Reduction in NHS England, an incredible practitioner who has done some amazing work through his charity. He said county lines, drug carriers are all being exploited, whether it's knowingly or not, by individuals or organisations who utilise them because they are impressionable. They are mentoring these kids to do bad things. These are children who are low on support, self-esteem and resources. And it's precisely these lack of spaces and opportunities that is part of what puts children and young people at risk. Research by a YMCA in 2021 found that in England, local authority spending on youth services totaled £379 million, a £1.1 billion cut in youth services from 2010. And in Birmingham, I'm hugely relieved that despite the current challenges at the council, all youth centres are now going to remain open and be retained by the council or partner organisations. It's a huge testament to the importance residents and young people place on these services in our city, and I want to thank everyone who made their voice heard in the recent consultation. Communities and families have solutions and they need to be part of the plan for change. I'm really excited about the 10-year Young Futures programme the Home Office is working on, as it has the potential to do great things in my city. The creation of a new network of youth hubs is exactly what we need, and I would be grateful if the Minister could meet with me to discuss the provision in Birmingham. Across England and Wales, there were 50,000 knife-related crimes in the year to March 2023, and around 5,000 of those in the West Midlands Police Force area. I'm heartened by the Home Secretary's categorical commitment that every youngster found carrying a knife will trigger a rapid intervention, including a prevention plan, to stop them reoffending. Identifying those young people before it is too late is half the battle, and when the signs are there, we must act on them. I wonder if the Minister could say more about the plans laid out in our manifesto this summer to place youth workers and mentors in A&E units, pupil referral units, and I want to pay tribute to brilliant charities like Red Thread in my patch who have been working at the Queen Elizabeth Hospital for several years. I mentioned Martin Griffiths as surgeon and clinical director. Well, the work he's pioneered at his A&E as a trauma surgeon is extraordinary. So often, many young people would turn up to his operating table, and he had seen them many times before. He realised that A&E admissions were a critical opportunity to intervene. And he has a multidisciplinary team at his hospital and based in A&E. And instead of just patching up children and sending them on their way, the team actually helped them to get education, work, or somewhere to live. There is mental health treatment, advice on special educational needs, and the police provide protection and support for those who want to get out of a gang. And the hospital allows the patients to stay there until it is safe for them to be discharged. And the results have been incredible. Readmission rates have dropped from 30% to 4%. Red Thread have a similar model and have demonstrated similarly remarkable results. 90% of the young people supported by Red Thread did not return to hospital for a violence-related injury in the following year. And 6 months after the intervention, 100% of the young people supported said they felt as safe or safer than they had before the incident. And young people who engaged in the full programme were 51% less likely to reattend than those who didn't. And a cost-benefit analysis showed that for every £1 spent, there was £4.90 economic and social benefit. I wonder if the Minister could say more about the multidisciplinary and multi-agency working to address violence or exploitation. Finally, we need to crack down on the criminals and routes into serious violence and crime themselves. Personally, it baffles me that we still do not have a specific statutory definition of child criminal exploitation. There's been multiple definitions resulting in a confused and fragmented response by authorities, and investigators have to use laws on modern slavery to punish those coercing or forcing children to move drugs. A new offence of criminal exploitation of children would allow us to go after the gangs who are luring young people into violence and crime. And I look forward to working with the government on its plan to introduce this new law in due course. So, John, I'm proud of the swift action the government has taken to tackle knife crime so far, banning zombie-style blades and machetes that were used to kill Ronan Kunda in Wolverhampton, setting an ambitious mission to halve knife crime in a decade and launching a new coalition to tackle knife-enabled crime, working together with technology companies, sports organisations and the health service. But there is undoubtedly a lot more to do. So I'd be keen to hear from the Minister on when she hopes to bring forward the crime and policing bill so we can move ahead with the Young Futures programme and strengthen those laws. The message we need to send to young people is one of hope and opportunity, that our society cares about them and we are invested in them and their futures. Tackling knife crime has always been about prevention and protection as much as prosecution. And after 14 years of abject failure by the last government on this issue, I am looking forward to working with the Labour government to deliver change that saves more lives. Thank you.